lecture about Tetralogy of fallot. 75% of all cyanotic congenital heart disease in infants under 1 year of age are Tetralogy of fallot, which is composed of a large VSD, pulmonary stenosis, right ventricular hypertrophy, and overriding of the aorta. As we seen here, for normal heart and compared to the heart with a Tetralogy of fallot, an increased outflow in the aorta, partial obstruction or stenosis of right ventricular outflow to the lungs, and pulmonary valve ventricular septal defect with right to left shunt and thickened right ventricular hypertrophy. The pressure of the right ventricle and left ventricle are equal, and the VSD shunt direction is from right to left and cause desaturation, systemic circulation, and cyanosis. Symptoms: initially acyanotic, then decreased exercise tolerance, then may show signs of heart failure, poor feeding, poor weight gain, and tachypnea without cyanosis, being TOF. Children show frequent squatting and hypoxic spells, which is characteristic of Tetralogy of fallot. Hypercyanotic spells occur from 2 to 4 months of age, characterized by sudden occurrence, worsening of cyanosis, deep rapid respiration, irritability, restless and agitated child, and then become lethargic. May lead to seizure, hypoxic brain damage, and even death. And the toddler may squat during the spell and disappearance of the heart murmur. When the spells occur once, they are progressive. They are going to happen again. Usually occur in the morning after crying, feeding, or defecation. Why? Because there is increased physical activity that goes suddenly lowers the systemic venous return and produce a large right to left ventricular shunt. And if it's not corrected, establishes a vicious cycle of hypoxic spells. Physical signs, as we said, cyanosis, tachypnea, and clapping if present for a longer time. Right ventricular lift or heave, S2 single and loud because of the pulmonary stenosis. Pulmonary stenosis, the pulmonary valve is not closed. High-pitched systolic ejection murmur. Chest radiography, boot-shaped heart. Heart size is not large, and pulmonary vascular marking had reduces, but there is a typical boot-shaped heart. It's not large, but a boot-shaped. Radiography, location and size of the VSD, characteristic of the pulmonary stenosis, and associated cardiac defect. Cardiac catheterization, diagnostic factors. Tetralogy of fallot, boot-shaped heart, as you see here, apex rotated superiorly, oligemia, enlarged aorta, and pulmonary artery. Boot-shaped heart. Natural cause: pulmonary stenosis, more cyanosis, more polycythemia, severe hypoxic spell causing hypoxic encephalopathy, right to left shunt, risk of bacterial endocarditis and brain abscess, long-standing ventricular volume and pressure overload, heart failure, arrhythmia, bacterial endocarditis, etc., secondary cardiomyopathy, and die. The treatment of hypoxic spell is knee chest position, O2, morphine, sodium bicarbonate, intravenous fluid, beta blocker, alpha agonist, epinephrine, and surgery. Why? Knee chest position to decrease right to left shunt. How? By increasing pulmonary blood flow, by increasing systemic venous return, and increasing systemic vascular resistance. O2 for hypoxia, morphine reduce hyperventilation and terminate hypoxic spell, sodium bicarbonate for metabolic acidosis, intravenous for hydration, and beta blocker propranolol for tachycardia, alpha agonist phenylphrin increase pulmonary blood flow, epinephrine if the spell continues despite above the treatment, and if the hypoxic spell continues despite all the above mentioned measures, emergency surgery should be performed. Prevention, patient education, oral propranolol therapy, and iron. Timing: if there is symptom, do it now. If there is no symptom, wait for 3 to 6 months of age. And thank you.